Good afternoon. Whoa, that's loud. Good afternoon, everyone, and welcome to Rotary's Celebration of Service. My name is Tracy Ivanovich, and I'm thrilled to serve as your president. And I have asked Phil Amerson to take over Thought for the Day and Reflection in one fell swoop so that he gets combined time. So, Phil, if you would do the honors.
Thank you, Tracy, very much. Many of you know that last week we celebrated the 25th anniversary of Beacon, and we also had former Mayor Fernandez here last week, and all of that led to me writing a column for the newspaper. I don't know if it will appear or not, but I shared it with some folks, and Tracy asked if I would share this with you. Just a couple of words as I start. Number one, I'm writing this as a former or current clergy person, I guess. I'm still alive. So it deals with faith communities, but you may want to apply it to your group, whether it's philanthropic or a cultural or a social service group. Perhaps there's some things here for you as well. The title is Faith Communities Could Boldly Lead. What makes Bloomington bloom? What offers vitality, hope, knowledge, and hospitality? We have great institutions, education, health science, manufacturing, and culture. Innovation and technology are known as essential. Still, Monroe County seems in the doldrums, waiting for a new gust of imagination or initiative. A community's well-being is complex: jobs, housing, education, racial diversity, and cultural amenities. Not thriving at a high level, we bump along. Among our disquieting realities, first, declining population and lagging diversity. Since 2000, non-university related population is down 1.5%. Racial and ethnic diversity lags other peer communities. Lower wages, number two, and productivity. At FutureCast 2025, Philip Powell, director of Indiana Business Research Center, noted core worker population, that of 18 to 44, continues to decline in Monroe County. We are below the U.S. and Indiana in average wages and in productivity. Bloomington will, according to Powell, quote, live and die by the talent that is here, close quote. Third, cost of living and housing expenses are among the highest in Indiana. Demand for homes outpaces supply. Essential service workers must live outside the city. And finally, the homeless. With little voice and few options, hundreds find shelter in a tent or a doorway. Some in an automobile. Some couch surf. Others are in jail or a healthcare facility. Scores move every few days from one unwelcoming location to another. In research, something strange happened for me. The same number, 143, popped up on different topics. Mere coincidence? The Association of Religious Data Archives reports there are 143 faith congregations. Another topic found 143 persons with no shelter at all, and another 300 plus were classified as homeless as well. Might each faith group offer shelter for one person? 143? Too simplistic and unlikely. I think not. Faith communities vary over time, as do the populations of homeless, but not that much, and both continue to grow. If Monroe County seeks more imagination, innovation, growth, and productivity, should we not leave it solely to the work of corporate, government, service, and education sectors? What role might faith communities play? What if for the next 5 years, 2025 to 2030, congregations added 143 safe places each year by building, renting, or otherwise providing shelter for our poor. What if faith communities reached out to know persons without shelter, not as clients, but as neighbors? In these frigid days of January 2025, two churches, First Christian and First United Methodist, stepped up offering emergency shelter, a warm space, a small respite, a bite to eat. Beacon Incorporated and Wheeler Mission did the same thing, expanded the space. Might faith communities cooperate to end the need for such emergency housing spaces altogether by next year? Let's not get carried away here, Phil. This is not a sermon, but the Jewish and Christian scriptures are clear. I could cite many, but we'll just go with Isaiah 58:7 or Matthew 25:35 to 40. Among so many other passages, they call on persons of faith to shelter the homeless. As some leaders seek new vitality in technology, research, and innovation hubs, might imagination also come for our faith communities? Congregations could assist the housing authority to support Section 8 vouchers. By the way, we've given them away for several years. Weren't enough people to say we'll do that, homeowners. Might we offer volunteers and gifts for places like Heading Home, New Hope for Families, Habitat for Humanity, Wheeler Mission, or Beacon? We could become known as a place where faith communities offered one critical, stable, baseline amenity, housing for the poor, along with wise, research-based care that could lead to recovery, employment, and fuller citizenship. A place to start now is with support for Beacon. You can talk with Forrest about this. A proposed new center will offer more comprehensive approaches: shelter, recovery, job training, space for prayer and meditation, care for physical and psychological differences. 143 could join corporations, the city, the community foundation, university, and social service groups in modeling a better way for Monroe County, our state, and our nation. Even if only half or a third of our congregations, or if only a couple of dozen could boldly act together, they could make a difference so that Bloomington would be widely known as a city in the bloom.
I think you just took my phone, but it looks good on you. So thank you. Thank you, Phil. Now, if Glenda can make her way, and while she's coming up, I thought that it was important to share that message just in reflecting on what John had shared last week in the program and some of the questions on how can we act. We act every day. It takes the entire, if we want this community to grow, we have to help it grow across all elements of the community. And we have to be part of that change agent. So thank you for sharing that, Phil. And now, Glenda, if you'd introduce our guests.
We have a number of guests with the speaker today, and someone else is going to get to introduce them. But I'm going to introduce Jackson Morris from the Rotaract Club, Yaya Kader from the Rotaract Club, and Wasif Ali from the Rotaract Club. We're pleased to have all of you with us today. Anna Rennie, who is Connie Shakalis' guest. We're glad to have you. Brianna Solola, who is Jim Bright's guest. And Gene Devane, I'm going to introduce him because I know him anyway, but he's part of the group that will get introduced in a minute with our speaker today. Well, he's Charlotte's guest, actually. So welcome, Gene.
And Lori, do we have any guests online?
No guests. We are all Rotarians today online.
All right. Thank you so much. So for birthdays, no birthdays this week, but anniversaries, Mr. Amerson, Reverend Amerson, you are 4 years, Jill Bond 1 year, Bill Brown 4 years, and John Weichert 6 years. A few announcements to share with everyone. First of all, I am ecstatic to share that Sarah Greenwell, who many of you may have met, and was endorsed by our club, was selected by the Expanded Global team to go through as a scholarship winner, which is amazing. So she will be our 25-26 Global Scholar. And thank you, Jeff and Charlotte, for all the work you did Saturday, working with the team on interviewing. She, as you may recall, she's pursuing her master's degree from the University of Melbourne in Australia, studying the health benefits and challenges of the original Aboriginal people and how to learn from that. So very excited about that. Secondly, I think we are all aware there's been a lot of changes in the past few days with the government. And while we're not political, we do have an implication as we've sponsored an Afghan family. And I hope all of us are aware of that effort to bring Nasim, which is Amina's fiance, here as he was living with David and Cindy for quite some time as he was working through the process. We need your help. Sorry. Nasim is Jawahir's nephew. So we are working on bringing him over, but right now things are kind of frozen. So it would be beneficial if you have time to submit a letter to our government people. That would be fantastic. Senators, congressmen, there will be a link in the roundabout. So if you're so inclined, we'd certainly appreciate that support. Thirdly, we have a service opportunity, a great example of partnership. Sarah Laughlin and the community service team partnering with Liz Irwin and Duke Energy. We get to work on February 28th. There are 2 shifts at the Hoosier Hills Food Bank to pack food for the pantries and partners. Natalie will be sending out the sign-up sheet. So everyone sign up for that. And next one, not on a good news note, many of you may have seen Claudia Hazel passed away last Friday. Paul Hazel is an honorary member, and he was treasurer for quite a few years. His wife passed away. Her viewing is today, and the funeral service will be tomorrow morning at 11 at the Funeral Chapel and Crematory of Powell and Deckard on 3rd Street. So please attend if you are able. And then lastly, before we go to Happy Dollars, I have a club update on the board members. As Liz Feidel is taking on her new role, the nominating committee selected Mark Peterson to replace her as secretary for the remainder of the year, and Caleb Poor will replace Mark as a director at large. So very excited about that. The board voted online and approved these appointments. And then just a reminder, we will be voting as a club on the March 18th club assembly meeting for the entire slate. And with that, let's move to Happy Dollars. I want to point out for Happy Dollars, we are making a targeted ask this time to fund 5 scholarships to the upcoming district conference on April 26th in Indy at Keystone at the Crossing. The fee for each attendee is $140 per person. Jeff Richardson and I have already funded 2 of the 5 slots, and so we need $420 more so that we can send a total of 5 new members who are with the club less than 2 years to the conference to learn more about Rotary, network, and of course, number 5, have fun. So, do we have any Happy Dollars?
I have 5 Happy Dollars for our 2 grandchildren in South Carolina. They're in Charleston, South Carolina, and they're small. And this last week, they were exposed to their first snowfall ever, making snowmen and snowball fights and whatnot, snow angels in Charleston, South Carolina, something that doesn't happen very often.
Okay, Liz?
I have $20 to donate to what you were just talking about. And I also want to say I saw the Come From Away last night. It was fantastic.
Awesome. Right. I see Alon over here. We're making you work hard, Michael. Putting on his PF flyers for those of us that are old enough to remember that.
So I'm on the conference committee, and I'm going to give $50 to support one of our members to join us at this fantastic conference that's happening, the Rotary Conference up in Indianapolis. And I urge you all to go. This time around, we're going to have 3 districts that are joining together. So if you ever want to see Rotary in action, multiplied by 3, this is the time to do it.
That's awesome. Gus?
I've got 20 Happy Dollars Connie survived her colonoscopy last Tuesday.
Connie's going to get even with you, I think. Do we have any other happy dollars out there? Anyone online? All right. And-
Natalie, you could put me down for $25 too.
Oh, thank you. Thank you, Michael. All right. And with that, we will have Dame Charlotte announce our program.
We are lucky in Bloomington to have two hospitals, and we're going to hear from one of them today. It's the hospital that I brought my husband to when flying back from Germany, 2013 or so, believe it or not. And he was well treated for 3 midnights till he could be released to a rehab facility. But ever since that, I've had a few little excuse me, little incidents to which have taken me to this hospital. And every time I've had a very good experience, it's always been extremely clean and nice. And the rooms are wonderful and so forth. It's a wonderful facility physically, but including that, it's a wonderful facility in terms of care. And I advise all my friends who can, or even my enemies, which of course I don't have any, to go to this place because it's been so responsive. I just walk in there and they know who I am now. That's not a good sign. I should have given a happy dollar for that. Didn't sound like the right thing. Anyway, so here we have today a number of the members of the leadership there. Paige, Leanne, and Tracy. Tanya. Tracy and Tanya in my head. Okay. Does that ever happen to you? Anyway, this Tanya is here and we want to welcome them. And then our speaker today is Dr. Singh, who I found out actually took care of my husband. We just found that out, that he was here to receive the ambulance from O'Hare when Paul was medevaced or whatever from Germany. And he stayed here for his requisite 3 nights. And I filled in after that since then. But this is Monroe Hospital, which is a beautiful facility out on what I used to think of as a bypass. Now it's practically the middle of town as we grow. So I'm very glad that they're here. And we also have a guest, Jean Devane, who's on the board of the hospital and whose son, in fact, is on the staff there. So we have a wonderful representation of a hospital that's kind and gentle and very effective and very, very clean. I stress that because that's been an issue with some people in the past with other hospitals. So I want to welcome them today, and I want you to hear what Dr. Singh has to tell us about this really important part of our community. Thank you.
Good afternoon, all. Thank you for having us here at this beautiful afternoon. And it has been an honor to be a part of this initiative where we are getting the community involved. And we wanted also to be present here in order to sensitize the community about our presence here. And Mr. Devane has been very kind to us being on the board for the last almost 2 years now. And he is the person who has brought us with the brilliant idea to integrate us in the community and be in front of you guys and take a few minutes to give you a brief overview of the small little facility we have on the south side of town. And we just want to bring up some of the good work we have been trying to do and share our achievements, as well as try to tell you what services we have at the wonderful facility. I am Dr. Amandeep Singh, and I am the Chief Medical Officer as well as a practicing physician in the community. I have been on staff for almost 13 years now, and it has been a joy to practice medicine in this beautiful community. My wife is a physician as well. She practices there as a pathologist. I'm an internal medicine doctor, so I do hospital medicine, so I take care of the hospitalized patients. We take pride in serving those patients, and our satisfaction scores essentially define us. And as we go along with a few pointers about our hospital, we proudly share that we are a part of a big organization or a corporation called Prime Healthcare out of California, who bought this place back in 2014-15. And since we have been doing a lot of work to improve the facilities at the hospital, we saw that whole highway getting built, which was quite a challenge for the hospital, just because our parking lot was just a driveway for the cars to go around, and it really impeded the hospital operations for a little while. But now it's easily accessible. We are on the Fullerton Pike exit, and I think with the opening of the new Fullerton Pike, we will be even more accessible to the patients. I have here with me Leanne Tolliver. She's the Chief Nursing Officer. Paige, our marketing director, she is an IU graduate, and we are happy to support local and then try to do our business development and marketing with our local people here. Tanya Ashmat, she is with us since St. Vincent Dunn closed down south in Bedford, and maybe Leanne can also chime in a little bit to tell that how we were able to integrate a lot of staff from St. Vincent Ascension Bedford after they closed to continue with the mission to support the communities we live in. My two beautiful kids, they go to school here. One goes to Tri-North Middle School in 7th grade, and my daughter goes to Binford in 3rd grade. So we are well rooted in the community. I've been here 13 years and counting the blessings every day to be part of the community. We take pride in the work we do, and being small still, we are able to deliver a lot of good to the community. So without taking much more time, I'll go through this few of the slides we have, and then we can have a brief Q&A session where you could ask a few questions of what you might have, and then we will try our best to answer those. And after the presentation, if you still have any more questions, Paige is available. Leanne and myself, along with Tanya, are happy to help. And it was not until today that I kind of even knew that I met Charlotte. Probably I met her more than a decade ago. And this is like a really warm story to share. I was in the hospital. I get a call from Germany about transferring a patient to Monroe Hospital. And we were like small, little, tiny place. And I was kind of surprised to getting the call, but they insist, like Charlotte's family insisted that we do the transfer to my hospital, which I felt proud about. And then I spoke with a doctor in Germany, which felt like, they had done wonderful care, but we need to continue the care to get him to rehab. And then I said I was more than happy to facilitate the transfer. We got him here and we took care of him. But up until today, I didn't know that I'm going to come across that event that happened like a decade ago. And every day we hear some of those, I call them miracles. Hospitals probably are not the happiest places to be in, but again, still, when you need care in those times, we are there, and we try to make a difference in those situations when you need health care the most. So thank you for support, Charlotte, and thank you for having us here. Okay. So Okay, so like I said, we are on the south side of the town. We are 32-bed acute care facility. It was built in 2006, but it had its own challenges. But Prime Healthcare took it over in 2015. It's a medium-sized corporation. This is going to get even better. They took another 10 hospitals in Chicago recently. So there will be like around 55, 60 hospitals. They are also in agreement in Maine to take 4 more hospitals. Healthcare is consolidating and it's ever challenging. Our corporation has more than 45,000 employees. Our hospital is one of the smallest they own, but we take pride in doing the great job. As we are top in some of the scores. And to name, these are like Medicare regulated scores called ED HCAHPS and inpatient HCAHPS scores. And we take pride being in top 2 all the times for the emergency room care as well as the inpatient care. Last quarter, we were the top. So being small doesn't mean that we lag behind. And we outperform most of our sister hospitals by fair margins, which is phenomenal. And we get complimented a lot by our patients. And once we serve a patient, they are more than happy to bring their families when they are in need. So our mission is to deliver compassionate quality care to the patients and better healthcare to the communities. Our values are quality, compassion, community, and our corporation is physician-led, and physicians are a key part of the leadership at Monroe Hospital as well as Prime Healthcare. Prime Healthcare is owned by one doctor, Dr. Prem Reddy. He was a practicing cardiologist, and he manages all the hospitals with his other staff. But he really values the physicians and he really values the patients. And he's himself integrated in operation of all the hospitals. We are an acute care hospital. So what that means is we have a lot of inpatient services. We have a 24/7 emergency room. We also have a medical clinic just across the hospital where we have a wonderful wound care center, which has really seen uptick in the patients, and we are providing wound care services. That's where Gene's son practices, as Charlotte was telling, and we are happy to have him on staff. We have 24 medical beds, and we have 4 progressive care beds and 4 ICU beds. We have on-site pharmacy, on-site lab. We have a whole radiology outpatient department, CAT scan, MRI, ultrasound, mammography. We do outpatient colonoscopies, emergency room services. We really take pride in, especially without commenting on the bigger hospital, which have big shoes to fill in. But we do a phenomenal job with the ED care. Our wait times are less than 15 minutes, which is phenomenal. And even with those short times, we are able to see those patients diligently. And I think within 20 minutes, they see a doctor. And we have seen big uptick in volume in the emergency room since after COVID. I think COVID was the watershed line where we participated in rendering care to the COVID patients. We had some successful stories which were even published in the newspaper. We were the first one to bring the monoclonal antibodies infusions, and Dr. Schmaltz from the community had been the biggest supporter for a long time. He retired, but we have a group of other physicians who are dedicated, and they're integrated to provide the wonderful care to achieve all this, what I have been talking about. Okay, so I think one great point about the emergency room department also is that we have a special app called Get Care Now, which is pretty neat. You could schedule an emergency room visit by going on to this Get Care Now. It sort of serves as an urgent care visit, especially during the downtimes, early mornings. We have open spots where for the urgent care needs, you could schedule an appointment and could be seen right away rather than waiting hours either in urgent cares or in the emergency rooms. We could probably have some more information if you would need to further see about Get Care Now services. Wound Care Center, again, this is a pretty neat state of the art with hyperbaric oxygen therapy. So we see a lot of wounds in the community, and we do hyperbaric oxygen therapy where the healing is achieved through hyperbaric oxygen chamber. We have seen a huge need for that in the community, and we have really increased our volumes. We have added another physician, Dr. Robert Singh. He does a lot of wound care as well as skin care and surgical skin care at the wound center, along with Dr. Topolgus and Dr. Devane. These are a few of the pictures to share about our community and staff engagement. We have a program which we launched just a couple of years ago when we brought Mr. Devane to the board, and it is called Grow Monroe. And we are trying to integrate ourselves and market ourselves to the community to recruit locally and try to engage the patients, the staff, as well as the community into our hospital and try to get the hospital integrated into the community. We are a Leapfrog A hospital. We are Joint Commission certified. We do some of the things that are pretty unique, where we do a special procedure called TCAR. It is for carotid stenosis, which is becoming a standard of care with no need of surgery. It is just a catheter treatment, and we are the only place in Southern Indiana doing this. And we started it here. So being, like I was saying, being small doesn't necessarily mean that we cannot do stuff. So we are doing pretty neat stuff with wound care, with carotids, with our emergency room care inpatient, and many more examples to share. Besides that, it has been a challenge as well. So I would not say that it comes without a challenge. Being small creates a lot of challenge, especially when the EMS services are aligned with the bigger hospital, IU hospital. But we tend to provide the best services we can when we see the patients, and our patient satisfaction defines us more, and the service and quality defines us more than anything. And the staff is really wonderful. All we hear about is compliments, and we also take criticism or any input from the patients or any community members, try to see how we could improve services. We certainly want to grow more as far as providing and adding services. We were able to integrate the pediatrician. So we were able to save some of the doctors or providers from the closing of the St. Vincent Hospital. So we are aligning ourselves with different hospital systems as well, try to see how we could bring more services into the community. So those are the small little few things we are doing. We appreciate your help and lending us your ear to come and talk here about the small little facility. So maybe Leanne, if you want to come and say a few words about from the nursing staff leadership standpoint.
Okay, better. Well, we've been able to make a remarkable progress from what we were back in the COVID days. For a while, we had many different, we had a lot of travel staff, as a lot of hospitals and facilities did, but we've been able to successfully recruit a lot of nurses. We are down to actually only one travel nurse right now, which is great. So we've done it, like Dr. Singh said, with the photos you can see, we do a lot of staff engagement and try to patient satisfaction as well. And we get all of our staff really involved in that. So we try to do a lot of activities to increase the morale for the hospital. And I think that's been one thing that's helped us recruit good nurses and keep them at our facility.
Thank you, Leanne.
This is more of a testimonial of my own experience. I ended up at Monroe Hospital as an emergency room patient with what felt like a cardiac event. I have a hiatal hernia and gastric reflux disease, and sometimes it's just hard to tell whether that pain in your chest is related to, that, or whether it's related to something else. So it gets me seen sometimes. But I want to tell you that in being seen, I was in promptly, I was cared for very professionally, and I would give them 4 stars out of 4 stars. It was great. Thank you.
Thank you. Thank you so much.
Warms your heart.
Thank you.
Thank you for your presentation. The big question for many of us is insurance. Could you address how that is? My insurance is IU Health Insurance, and I don't know whether it would cover if I came to Bloomington Hospital. Thank you. Monroe Hospital.
Yeah, no, thank you. The insurance, I think I was just speaking before the event with Mr. Gilmore, and he also brought up the same question and shared the same question you had. As far as the emergency care goes, the law stipulates that insurance cannot dictate where you seek emergency room care. That is law. So you could go seek emergency room care any place. Now, as we all know, the insurances dictate a lot of what you can and cannot do at a participating or a non-participating out-of-network facility. So it is always good to check the service you are seeking, whether it will be covered or not. But we have professional people who could help you answer some of those questions. And sometimes it is, if the patient themselves are asking for a service to be covered at a certain facility, the insurance has no choice but to authorize that. So that is something called pre-authorization, and you could get your testing or whatever procedure or whatever needs are pre-authorized, and you could seek care at your desired facility. So to reiterate, emergency room care, nobody can deny where you go, it's law. And besides that, we are more than happy to work with all the insurances and help you through the process with whatever we can do to navigate your insurance questions. Did I answer your question? Okay.
So in a past life, I spent a number of years as an outside director at a standalone hospital in northern Indiana.
Yes.
And in really simple terms, the difference between an okay year and a lean year was customer mix. And if the customer mix was weighted toward Medicaid or people who didn't have insurance, it was kind of a lean year. If it kind of moved in the direction of Medicare and those who had insurance, it was a little bit better year. And then there was also a state program sometimes that kicked in depending on underserved. So I guess, can you talk a little bit about your customer mix and how it works so that you can continue to serve the community?
Absolutely, absolutely. We take pride in serving Medicare population more than the commercial population. Essentially, we are in network with most of the insurances. Some of the managed Medicare products we are not in network with, but again, just to name Humana as one, but all of those claims are being paid and authorized. So what that tells me is insurances are also working more and more with us. Medicaid, there is only maybe a couple of products, and that is just also not because of us. It is the insurance are only contracting with one hospital and leaving us out of the mix, which is a little bit of a loss for us. But every hospital in Indiana has to pay a fee to the state, Indiana Hospital Association, which is a hefty fee but they do get some back-end benefits of that. But our population in Medicaid is not that much, so we end up paying more than what we even see. We are more than happy to entertain any and every insurance. And we have no problem serving Medicaid, Medicare, managed Medicare, or any commercial products.
Yes, I wonder, you mentioned you had 32 beds, so I'd be interested in like if your beds are always full, what rate of utilization you have of the space you have. Do you have people waiting in line or how does all that work?
Quite honestly, I would love to have all those 32 beds full with the community engagement because I see there's a huge need of that in the community, but somehow the patient distribution is lopsided with the bigger hospital having the lion's share, and we just have a meager share of the patient. Our occupancy has improved over the last 2 years as our emergency room volume and satisfaction stays high. That translates into especially serving the Medicare population, like we were talking a couple of questions ago. We are happy to share that we are seeing an increased number of geriatric patients who are happy coming to our facility, and we are more than happy to serve them. The satisfaction translates just from the care in the emergency room, where we are able to see them quickly, diagnose them quickly, and disposition them to either home or hospitalization as needed by their diagnosis. That gives us an opportunity to serve those population and increase the utilization of our available beds. We certainly have capacity. I hear that a lot, that there is no capacity, but we certainly have capacity. And Leanne, like mentioning, during post-COVID crisis, it was the staffing more so than the bed availability that was an issue, but we have been past that, and then we are able to staff better. But again, we can only serve the population we are able to see, which is again lopsided just for the EMS alignment with only one hospital system.
2 questions.
Yes, sir.
First question, to what extent do you ever collaborate with your competitors at IU Health? And number 2, 32 beds, too many, too few, or just right?
Okay. Thank you for your question. Question number 1, collaboration. We collaborate quite a bit since our leadership change here at Monroe with me and Leanne being a part of the executive leadership, as well as reciprocation from IU Health leadership. We have quarterly meetings with the executive leadership, and even beyond that, we have open communication with them, especially post-COVID. There was an increased need of open communication to send the community the same message for the care that is needed by the community, especially from the infection prevention standpoint or any of the issues there might be. Like we had that solar eclipse event where we needed to collaborate, and during these football games, and I think I anticipate this coming year would be good for the town as well. While we want to be there and collaborate with the emergency room services, and to point out, there had been some change in the emergency services on the county level, and we are proud to support the county fire department, Monroe County Fire Department. We donated 2 of the critical equipment that was the emergency, defibrillation and the monitors we donated to the Monroe County Fire Department. So we strive to work together because there is no other way to serve the population which is growing. So that was the answer to your first question. Now the second question is too few, too many. I think if we see more volume, we will be able to serve that, and that gives us an opportunity to grow more. And we have initiative we started last year called Grow Monroe, which includes growth, respect, one team, and working together. So the whole idea is to grow and try to integrate ourselves into the community. Yes, sir.
Any questions online?
Not at this moment. Thank you.
Two questions. First of all, what is the hyperbolic chamber?
Hyperbaric chamber.
Yeah, hyperbaric.
So hyperbaric chamber, it is, you might have heard about the divers using the device where, if they ascend too quickly, they might have issues with that.
bends.
So it is a oxygen under high pressure that is used to, it delivers high amount of oxygen to the wounds, which helps with the healing faster. So it is hyperbaric oxygen therapy, HBOT.
Okay, got it. And I'm a diver, so I understand that. I just didn't know that the wounds heal faster. So that's interesting. And then secondly, so when you talk about the fire departments, how do they assign which hospital an EMT goes to? Is there a process there?
I would shy away to answer that question. I don't know how they operate, quite honestly. Some days we see 10 ambulances and some week we don't see any. So it's hard for me to imagine. I believe it is there. They are managed by Lifeline out of Indianapolis from my last discussion as a part of collaboration to see how we could serve better, because what we were seeing is when there's a huge need, that when they are crowded, even our emergency room gets crowded. So we have been working together, try to solve that and understand the EMS flow, where if it was more constant flow, which would help both the hospitals. But unfortunately, I do not have a direct answer for that.
Couple of questions.
Yes, sir.
I know that telehealth is more and more in the news.
Yes.
Are you heading in that direction, and what are the ups and downs of that? Second question is, if unless I'm mistaken, I don't believe I am, the wellness of a neighborhood, of a zip code, is related to the wealth in that. What's happening in Monroe County to be sure that the poorer populations, the underserved population, is having good health care?
Can you repeat your first question again? Because
It was about telehealth.
telehealth, yes. So thank you so very much. Sorry, I was just engrossed in the second question more than the first. So telehealth is integral to healthcare delivery at this point. It is used outpatient as well as inpatient quite a lot. With the technology playing more and more, I think that is a part of life at this point. And some of the and this is probably what we learned, I believe, in every sector, not only healthcare after COVID or during COVID, is like even with the kids' education, the college education, working in the industry, the big corporations, everybody learned how to integrate telemetry or whatever you call as telehealth, or working remotely, or having online classes. So it's part of that. It is going nowhere. I think it's going to keep growing. And we do have providers that are available to do televisits. And we do use technology in-house as well, where it is hard sometimes to recruit doctors with their specialty training to a smaller facilities. So we use some teleservices like teleneurology, telepsychiatry, teleradiology, where they might be sitting anywhere in the nation. They're board certified physicians and providers, which we could integrate into our hospital to provide those services. So that is question number one. Question number two, for the population, certainly, I think with wealth, a lot of things are at your disposition, and you are at a disadvantage if money is a factor in all spheres of life, including health. Like I said earlier, we are more than happy to serve any and every person, regardless of their insurance status. So we do not look at the insurance to serve the people. Quite honestly, we try very hard, even for the people without insurance, when we see them either in the emergency room or in the hospital, try to get them to talk with the financial counselor to connect them with the right resources so that they are set up for their better health. So getting them access to insurance through a financial counselor or even charity care when possible to help with their health.
Do we have time for one more?
No problem.
So last year I sat in a different hospital with my son. Fortunately, he was fine, but for about 3 hours in the waiting room in the emergency department. So what are you doing that's so great? That how do you make those wait times so short? And is there anything that you can share with your competitors to improve the wait times?
Let me call it, how about this is a business secret, but no, it is not a secret. So it is just providing good care. I think our emergency room care is staffed by very engaged physicians, and they take pride in delivering good care. So it is not only fast, it is quality care, and it is substantiated by the independent surveys we get. So we are not doing those surveys. They are a third party CMS mandated surveys for the EDH caps. You can look into that. You could compare our hospital to any other hospital. I don't know for how far away. You could put the mile distance. You can go to cms.gov hospital compare, and you could compare different hospital and different outcomes. I remember maybe even like 7, 8 years ago, there was an article where we were providing care for the same diagnosis at a better cost for the patient. So I believe it is not only a fast care, it is quality care, which is financially beneficial for the patient and the hospitals and the insurance companies. We all have to work together. Yeah, it is the people that make the difference, I would say. Yes, sure.
Hold on, Charlotte, hold on. We have time for a very brief testimony.
Okay, I've been there several times, as I say, always to the emergency room. I always get right in and immediately there's an initial diagnosis, and they decide what they need to do first, and they do that immediately. And the results are very, as fast as you can get them from the X-ray or whatever they are.
Yes.
And they explain things very, very clearly, and then they check, and then I go home and I get well. So I really, I just, that is a factor that I think impresses people, because what do we hear? We hear hours and hours in the waiting room.
Yep.
With my husband, when they were taken to the other hospital, not naming any names.
No, absolutely. I think being small also gives us an advantage to be
Yes.
very lean and able to provide diligent care fast enough rather than just, I think even for the bigger hospital, they are doing great as far as, because they have much more complex patients to take care of, but sometimes you all don't always need a big facility for a small condition. So we are trying to collaborate where we could be a resource to the patients who we can adequately and satisfactorily treat at our facility. So we are not trying to promise something we cannot do. We are aware of all of our challenges, and we try to do the best with what the resources we have to offer to the patients. Yep, thank you. Thank you. Thank you. Thank you.
All right. So as always, we will be donating $100 to the warehouse in honor of your program, Dr. Singh. So thank you for that. And then acknowledgements. We couldn't have this program without the help of all of you that have chipped in today, starting with our executive assistant, Natalie Blaze, who's amazing. Art, as always, great job greeting. Glenda, nice job on the introductions. Phil, thank you for doing the reflection and getting us to think a little more deeply. Kyla on the reporting, Michael on the PF flyers, going all through the tables on the camera and mic operation. And then, of course, Isaac, our new Zoom operator. Our next meeting will be on February 4th in the Frangipani Room with Valerie Yeager discussing strengthening Indiana's public health system. So kind of, we got a theme going, I believe. And with that, if we could all stand, if able, for the four-way test and share it. Of the things we think, say, or do, first, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? Fourth, will it be beneficial to all concerned? And fifth, is it fun?